All right, so thanks everyone for joining. So happy to be joined by Ms. Guadalupe Cornejo from Northwest Vista, and leader of the San Antonio Association of Community Health Workers. I'm really excited to have her on today to talk about code switching with us. So over to you, Guadalupe.
Thank you, and here we go. Always, we'll see if I'm able to share the right screen here. So you'll help me out, okay? Let's see. Now I'm sharing my notes, right?
Yep. Okay, and then switch.
I switch. Okay. I can do this better when I'm in my. No, I was gonna say when I'm in my classroom, but that's not true.
If you go up to display settings, the top left, just at the top of your screen, it says like show taskbar.
Oh, yeah, it was blocked.
Yeah, and then do display
and swap.
And then swap.
Okay, so
Perfect.
Right there, I'm good right there?
Yes.
Okay. All right. Well, thanks everyone for joining us today. I'm Guadalupe Cornejo. I really appreciate the fact that you're making the time to out of your busy day and your lunch hour to be with us. I'm Guadalupe Cornejo. I'm currently an assistant professor of community health at Northwest Vista College in the Department of Computer Science, Technology, and Business. So I will attempt today to talk about code switching and share with you a couple of strategies to hopefully help you improve some of the efforts that you are already doing in your work as a community health worker, promotora de salud, or instructor.
Oh, just take everything out.
All right. So sharing this pictures not to just show you pictures of me, but I'm attempting to share just what code switching looks like before I go into the actual definition. So if you see that picture on your left upper right where you see me smiling, that's my natural self. Hiking is one of the things that I like to do the most. Then following is another picture where I look a little more serious. That's what I use as my professional profile sometimes. Below that, you see me and a lady. That was during my time when I was doing home visits, during my work as a patient navigator with breast cancer patients. And the other picture is myself at a community event at a church. So with that in mind, I also want to share a little bit about my background. So I am a brown female, bilingual, now I can say bilingual, bicultural immigrant from Mexico. I have dual citizen. I was born in Mexico, but now I have the US citizenship as well. I lived and went to school in District 5 here in San Antonio. For those of you that are familiar with San Antonio, District 5 is one of the poorest zip codes, and actually I lived in zip code 78207, which is one of the poorest zip codes that is always referenced in all the health reports in our Metro Health Department. I go to church and I work in District, I go to church in District 1 and next to District 5. And I work and play in District 7. All those are different zip codes. For those of you that are familiar with San Antonio, the city of San Antonio, all those 3 districts I mentioned are districts that are, you look at their profiles, they have high levels of poverty, some low education attainment, and so on. I'm a community health worker, obtained my certification in 2008. I became a community health worker instructor in 2014 or so. And I'm a licensed master social worker. And like I said, now I'm an assistant professor of community health. I'm an advocate for my community in all those different identities that I share with you. And I'm a mentor for CHW students. I'm a mentor for Hispanic students. And students that English is their second language. As far as my work in the community, I am the founder and lead organizer of the San Antonio Community Health Workers Association. I'm a member of Enroll SA and all these different organizations that are on the screen. And I share that just to share with you the different roles I play in my different identities, if that helps. So code switching, this is one of the definitions, and I want to share that what I'm going to be talking about today, it doesn't come from a framework of academia or research. It's practical information that I have adapted for this conversation today. So code switching is defined as the process of adjusting who you are, the self, your identity, so that you can be accepted or that you can fit in different environments. Those of, and many of us do code switching, but what we do when we code switch, we may change the way that we behave, the way that we carry ourselves, our conduct, the way that we speak, the clothes that we wear, our body language, and how we express our identity. And who engages in code switching? So in all the review that I did, it was common to see that people who engage in code switching are commonly those that come from ethnic minorities, people of color, right? People who may feel underrepresented or that comes from oppressed places or have experienced discrimination. Very common for people that are bilingual or multilingual, bicultural, multicultural. And so what I'm sharing with you, it's my experiences in all those different areas. Like I said, I come from Mexico, and I am brown, and I said that because it had shaped the way I see myself, the way that I was told I look and perceived by others as I was growing up. So in Mexico, yes, there is racism, but there is also colorism, which is very prevalent. And in the Mexican families, Hispanic families, in my experience, si tú estabas güerita, you were the prettiest one, right? So the worth of was determined, or your beauty was determined by the color of your skin. And so I'm brown, and I was la negrita de la familia. I was, la morenita. And so I was growing up with that idea that was ingrained in me. And I remember that that's probably one of the main reasons that I learned how to put effort on my appearance, because I was not going to be accepted for the color of my skin. If I wanted to be complimented and validated and appreciated, I needed to put effort on the way I dress and my hair. So that was my experience. I came to the U.S. when I was in my late teen, and so it was hard for me to learn English. And for the longest time, I didn't speak up. I was just observing and taking everything in. So there was many occasions that I myself didn't advocate for myself just because of the language barrier. Now that I have more control of the language, I do consider myself to be bilingual. The English that I use comes from my evolution in school. So I probably won't be good at code switching with people on the street that use that type of language, but I'm probably more familiar with English that I learned in the textbooks. I am bicultural, so yes, I behave differently when I am around colleagues. I behave differently when I go to Mexico as well, and I go back and forth, right, with using my language and my culture. So what are some of the codes and pros of code switching? So the pros is that if we adapt our behaviors, the way we speak, the way we carry ourselves, it is more likely that we are accepted within the dominant groups or group. We may feel safer right, in certain spaces. And this is, of course, also impacted by the socio-political environments. I remember back in 2016, being brown and bilingual and speaking English as with an accent, and being out with my parents that only spoke Spanish or only speak Spanish, didn't make me feel safe. In many places, for the first time here in San Antonio, where the predominant ethnic group is Hispanic. But when we were going more up north, where there were other, more people that didn't look like us, for the first time, I experienced what it will be like not to feel safe just based on who you are, and what language you speak. Another benefit of code switching is that we may have better experiences navigating certain spaces. I get different reactions when I show up I'm the caregiver for my mother. So when I take my mother for doctor's appointments, sometimes and on my days off, I just go like my regular self. I don't put on my business casual attire. And I speak Spanish because I'm with my mother. And I do get different reactions and treatment from people at the front desk, even from doctors. When I dress up differently, I get better treatment, right? So I use that accordingly. When recently I was helping a family member going through a workers' compensation case, and I was tired of hearing her talk about how unfair she was treated at that location. So I dressed up, I went, I fit in as other workers, right? So I didn't have to give a lot of explanations of who I was. My sister was already in the back room. I was a few minutes late. And when I presented myself to the front desk, I said, I am so-and-so, I'm here with the patient. The patient is in the back, and you please let me in. The way I dress, I realized, and the way I presented myself, didn't allow for questions of who are you, why are you here, and what's the relationship with the patient. At the end of that encounter, I found out that they made the assumption that I was a caseworker. So that's just one example of how we can use code switch to enter and navigate spaces and experience perhaps better quality of services and treatment. But what are the cons of code switching? It's tiring at the end of the day sometimes, right? Because it takes effort. It takes effort to plan what you're wearing, depending on where you are going to be showing up, especially if it's the first time that you will be navigating that space and meeting new people. So it can be overwhelming mentally and emotionally. Overall, I think it can be a reminder of oppressive systems that people of color, minorities, people that have been oppressed or discriminated against have experienced. And it's so, and people as such, we have to mentally prepare ourselves for those encounters. So yes, it can be overwhelming. It can lead to burnout. It's a reminder of social acceptance, right? The conflict between who you really are and what is socially accepted. So from after this, what I'm going to do is I'm going to use this information and then I'm going to talk about how community health workers can use this code switching from an asset-based perspective. Because what I found in my classrooms and with my colleagues and myself is that most community health workers identify with some of the things that I mentioned about myself earlier, or my experiences, or the experiences of people code switch. So we do that, we do that, all of us do that on a daily basis. So without really focusing on how tiring it can be to code switch, we're going to use that from a perspective of how navigating two different worlds can lead to something good, to something greater. And as community health workers, right, we are now navigating different places of employment. We are part of the public health workforce. And so we have community health workers that are perhaps the first one in their family to get a high school education or certification, associate's degree, bachelor's or master's. And you're navigating all these different places of governmental institutions. You're navigating academic and research institutions. And so you bring all the lived experiences and all the knowledge of the community and your culture to the benefit of this different organizations. Also, we have to keep in mind, what is our responsibility as a certified community health worker, and how who we are actually adds value to the work that we do and to the organizations that we represent. So based on the Texas Department of State Health Services CHW competencies, I kind of just picked 3 or 4 different competencies in the main areas that this information can apply, right? So we're going to talk about communication skills, right? And under that competency, one of the skills that we need to develop is that we need to give information to clients and groups in a clear and concise way. We need to gather that information in a respectful manner from the communities that we are serving or representing. Therefore, we have to be able to adapt the way we speak our language, verbal and written, in a way that connects both worlds, your organization and the population that you're serving. And so, but another skill in terms of our communication skills is how confident are we in implementing those skill sets, right? Because what I see sometimes is that I have CHWs that, my goodness, they bring so much wisdom and knowledge to the table, but maybe intimidated at the beginning to be able to confidently express themselves with others in front of people or in writing. And so those are areas that that I will be sharing some strategies that maybe you can incorporate to the work that you're already doing. So I will talk about communication and dress code. So code switching in regards to speech is in relation to the way that we go back and forth, right? Speaking casually to professionally in different situations, right? If you're communicating, if you are a CHW who's practicing in a clinical setting, you have the skill sets to be communicating effectively with a team of clinicians and then relating that information in more casual terms to the patient that you're working with. Being able to use academic language or technical language, being able to understand the reports that you read, and be able to engage in that conversation with your colleagues or other disciplines. Sometimes we code switch by using 2 languages within a sentence or discourse. As you see, English is my second language, and sometimes I'm truly by the end of the day tired of speaking in English, and so my Spanglish comes out. And I'm lucky that I'm in San Antonio, and I always have someone in my classroom or in meetings to help me out when I'm like, how do you say that in English? I can't even think about the pronunciation or how to say that. So I do go back and forth. Many of you know. Let's see. So what I was thinking that we could talk about effective interpersonal communication skills. This is a set of skills that we need as we are working one-on-one or in small groups, right? Many of us work in places where we know, you're not just providing or creating reports and not having any interface with the community or individuals, but many of the CHWs that I know actually work one-on-one with people. So how can you improve your confidence and improve your effective interpersonal communication skills? First of all, you start by obtaining adequate knowledge of the issue of the condition that you're talking about, right? Or that you are representing. I remember when I first joined my first job as a community health worker, my focus was on breast cancer and cervical cancer, things that I knew about, but I didn't know all the details. So I was fortunate enough to join a team that provided all that training on my onboarding. And then I took it upon myself to continue my development and understanding everything around patient care and resources. And so that was a way of how I improved my communication skills, by obtaining more knowledge about the area that I was working in. Understanding or doing an inventory of your values and willingness to withhold judgment about other people's values. I think that's very, very important, because you have to know what your values are, so that you don't enter in a conflict of perhaps doing some work or engaging in conversations that don't align with your values. And at the same time, what can you do to still be able to listen to others without putting judgment on people as they share their needs and concerns with you, and respecting their values. Skills in verbal and nonverbal communication. This reminds me of our ongoing efforts to improve our written skills, and verbal, in terms of how we improve our vocabulary, how we become more eloquent as we communicate with our patients and with our colleagues. In nonverbal communication, paying attention to the person in front of you, paying attention when they may agree with you verbally, but as you pay close attention to them, they may not be understanding truly what you're saying. So paying attention to body language, nonverbal cues, is also very important. As community health workers, we have to show empathy and encourage others. I think we do a really, really good job on that. Many of us are in this field because we felt compelled to work with others to improve and empower them, improve their quality of life, and empower them as a person or as a professional. So I think that comes easy. I would just add to that to take care of yourself, so that you don't operate and give more than what you have to offer in terms of emotion and mental capacities. And I'm not reading the chat, so I'm sorry. Feel free to unmute, or Shay, if you can tell me there's any comments or anyone wants to add an example or anything, please.
Yeah, so far we're good, but that is a good reminder that we will pause for questions and discussion. So feel free to chime in either on chat or taking yourself off mute.
All right. Another skill that I think is very important for our work is the ability to paraphrase and summarize the concerns of individuals and the community. And so there is sometimes we have to really engage in deep conversations as we are perhaps completing an initial assessment, an intake, or an application, or if it's a follow-up visit with your patient or your client. But being able to be there, to have your devoted attention to that moment and conversation, and be able to show to your patient or client that you were actually listening by restating the ideas the patient shared with you, or their concerns, by restating, rephrasing what you understood of what they said, so that they are able to know that they're being listened to, and gives them the opportunity to share with you their plans, or even to reflect on what they share with you, and vice versa. So very important process that we need to continue to practice. The ability to observe and interpret the behavior of other people, that kind of goes along the lines of paying attention to the nonverbal cues. In this interpersonal communication skills, it also talks about the skills to effectively use support materials depending on where it is that you're engaging in that communication. Nowadays, obviously, the technology, it's evolving. There are so many different tools and applications, softwares that we use to improve our work, to make it easier. And also to make it, to facilitate connections with patients that may not be able to come to your office and are remote. So having that ability of you understanding how the systems works, how the equipment works, is part of this skill set of improving effective communication, interpersonal communication. Confidence and flexibility. Flexibility in terms that depending on who the population is, we have to do our job in understanding what may be some of the communication barriers, where this person comes from, that may make communication or the interaction more challenging. And speak with confidence when you encounter any type of conflict, or when you feel that things are not going in the direction that they're supposed to go. I once had an experience where I was working with a male, and I was completing a housing application with this person. And we were meeting at a neutral location. It was a community center when we were completing the application. But at the time I was working with my client, he started going off topic, and he just started commenting on things like, oh, you have a beautiful accent, or you have beautiful eyes. And so those are things that sometimes as a female can really get you out of your comfort zone. And I remember that I said clearly, Mr. So-and-so, thank you, but we're here to work on your application. So please, let's continue and stay focused. And I said it, in a assertive way, still respectful, but confident, that we are not here to talk about my looks or anything else, but the application at hand. So again, being flexible, confident, assertive, and at the same time being kind. All right, so I found this, and I always love this graphic. I do follow this group, the Center for Creative Leadership, and they have this 6 skills for effective communication, for effective listening skills, right? So pay attention to your surroundings, pay attention to what your patient, again, those verbal and nonverbal cues, pay attention to where you're engaging in that conversation. Withhold any judgment. Like I said before, it's not about you, it's about the patient. It's not about your values. It's to try to understand what the patient or the client comes from, and give time to reflect, not to have an answer right away, right? We don't have to have an answer immediately. Clarify any doubts, any content that you are not understanding, or that the patient is not understanding. So clarify, again, summarize and share information back and forth with either with your patient, with your teamwork. All right, now let's talk about dress code. And like I said, dress code is something that some of the local employers have shared with us in some of the feedback that they get from us, and is that dress code is it's important for the representation of their agency, but it's also representation of you as a professional. So like I said before, we do code switch on how we dress depending on the occasion, right? So if you are working in an office or clinic setting, it's primarily a business casual attire, right? And so it is important that we dress accordingly. For us as CHWs, we have come a long way from establishing an identity as a profession. And so for me, I consider that the way that we present ourselves to the community, to other disciplines and other professionals, it's important. So by the way that you dress, you're establishing your identity. You're establishing also what role you play in that situation. It adds credibility. And I remember this from comments that I hear from las viejitas, las señoras mayores en la comunidad. And they're so, the elders, they want to see you as a professional. And I remember something that that stayed with me for many years, and is that one lady told me, and she was kind of criticizing the youth of today, and she was just criticizing the way that youth dress to go to the university. And so she was, growing up, she was used to seeing people dress. I mean, if you look at the dress code for people back in the, I don't know, 70s, 60s, 50s, the way the dress was differently. But I feel like and I don't know anything about fashion, okay? So that's not where I'm heading, but I'm just talking about, with the way that you dress, you're sending a statement of who you are in terms of your profession, and it adds that credibility that you are a professional. It also shows respect, again, because when in the community or in any setting for that matter, you are identified by the way that you are dressing. And if you're showing up to a clinical setting with a t-shirt and jeans, for example, on a regular working day, nothing wrong with that, but I don't think it looks professional to the standards of today, right? And so I would say in general, just dress accordingly. Practical, depending on where you are. If you're doing home visits, I still keep my professional, my business casual attire. I consider where I'm going, to consider what type of shoes I'm going to be wearing. Same thing with the community setting. If you are working in the community, again, you are the face of your organization. You're the face of us community health workers as a profession. So I think, it does require some standards in terms of even you people in the community or at the event identifying you as the leader by the way that you carry yourself and the way that you dress. But overall, I think every employer has a dress code policy. So as you navigate new employment places, one of the main things to do is to become familiar with that policy. For me, I think, like I mentioned before, dressing in accordance to my job, those boost my self-confidence. So I feel more I fit in. I feel more confident navigating all kinds of places, right? And so that's how I take this in terms of code switching and dressing according to the occasion or the location. All right, so this is just one of the standard recommendations for business casual for men to wear slacks or khakis and a button-up dress shirt, dress shoes. I know that many of us do work in community settings. So again, you adapt to this setting, but keep in mind that you are the professional, and also how we that may come from communities that we may be the first reference that our community members have to someone in a professional setting. These kids are looking up to you, and so you're setting an example. I remember for me growing up, being the first one in my family to go to college, I didn't have any reference of what it was to be a professional. So I think all my reference was to watching novelas, and just, that was kind of where I got an idea of how to dress up for a professional. For women, it's, wearing dress pants or a appropriate length skirt, right? It's not like it's maybe a couple of levels down than going to a party or a Sunday. So keep it casual, but still a professional look. Conservative shoes. Wear something that you're comfortable with and you can walk, right? That you're not gonna be adding extra effort on even how you move around the event or the location or the office. I remember getting feedback from one of our local employers on feeling that she needed to have a conversation with the CHW she was working with because of the makeup she was wearing. And it was such an uncomfortable conversation to have, right? Because it's like you're now criticizing the person, but at the same time, if it's kind of a little bit out of place, then we need to have those conversations, and that is, I do recognize that can be very uncomfortable for both the supervisor and the CHW. All right, so some of the skills you can use when interacting with your colleagues to improve your communication skills. I'm currently listening to this audiobook from Matt Abrams, and this just are some simple structures to consider, right? When you're bringing an issue to your team meeting and you don't know how to approach it, this can be a practical structure that you can use to write down and to review and practice how you want to bring this information to your team. And so it's basically the what, so what, now what. And so basically with the what, you're discussing the topic or the issue. You are also telling the story of why it matters to you, to your community, to your patient, or for the team, and then discuss the practical implications, right? It's not about just complaining or not doing anything about it, but it's being able to articulate what the situation is, why it's important that it get addressed, and what are some of the implications, practical implications. Another approach is the problem. Think of the problem, think of the solution and a benefit. So evoke the issue or talk about the issue, but also offer a solution, right? Not to be the one that's always looking at the negative and complaining, but don't have any solutions to offer. And so also by the end or end that conversation by discussing the benefit that your solution will bring to the team. Another approach is to seek and engage in collaboration. The work that we do, as we all know, cannot be done alone, cannot be accomplished by you in your organization only. It's about collaboration. It's about collaboration with your team, perhaps with different departments within your organization, and also with outside with different other community partners. So some things to consider to foster your collaboration is that you put an effort in strengthening the relationships of those that you are seeking collaboration with. Get to know them, get to know who they are, where they come from. Engage in active listening, right? Don't just join to have solutions or offer solutions or judgment, but actually to just be able to listen their concerns, to listen what perspectives they have and how they see the problem, and to focus on solutions. And the work that we do, of course, we encounter many challenges, whether those are processes, internal processes, or perhaps they are that have to do with eligibility criteria, things that are beyond our control. But if we focus on how we can find different ways to find solutions instead of dwelling in the negative or being, talking more about the issues and then providing solutions, that we're not going to get anywhere. and incorporate diverse perspectives. Consider, again, how the situation is impacting others from their perspective, from their way of seeing and understanding the problem and what they know and what has worked for them in the past. And consider everyone's input as you're looking for solutions and incorporating those perspectives into the solution process. Skills to interact with government or donors. This is just a simple formula that we can offer from our community health field methods class. Is that to be able to write a narrative that is concise, but it has content where you can explain the issue when you're speaking in front of government, any public figure or any funder or anyone that is outside of your organization, and that if you are in charge of explaining the condition, right? So this is one formula. You can start by step 1, introducing the condition. How do you do that? You gather information to describe the condition or issue. You're talking about diabetes, go to the reliable sources to define what diabetes is, so that you can inform whoever your audience is, especially if it is outside of the discipline, right? And find the vocabulary, the language to help them understand the condition. Number 2 will be describing the impact of the condition in your community. How is it impacting it? And with this is, to the extent possible, you're going to give them numbers. You're going to give them the data to show the impact, to show them how many people are, to show them perhaps the incidence rate, how many people are newly being diagnosed with such condition, how many people are dying, mortality rate, prevalence rate. So using the basic public health concepts in terms of data to actually describe the impact of the condition or the issue. And then number 3, to describe the root causes of the condition. And this is also where we bring our lived experiences and what we know from observing our community members or family members. And so these are the describing the root causes, is talking about the why the conditions exist. And I invite you to consider looking to this through the lens of social determinants of health, right? How is the, poverty, lack of education attainment, how are all these different socioeconomic and conditions impacting or creating the problem, right? And also, I always like to use the dimensions of wellness, your physical well-being, your spiritual well-being, intellectual, and all those dimensions to also help describe where the condition may be impacting or where the root cause is. Because as we know, in terms of health, it's not only having access to a clinic or hospital, right? Health happens in our communities where we live. So by having insurance, health insurance, for example, that doesn't solve in many cases the problem, right? Because the problem may be that I just don't know how to use my healthcare benefits. So again, trying to understand and explain the reasons why the condition exists, providing an answer to all this, to these 3 steps, can help you to concisely inform individuals, whether it's government officials or funders, about the situation that you care about. And that concludes my presentation. I attempted to define code switching, and I share with you a couple of strategies to use as you're engaging in communication with individuals or peers or with government officials or funders. And what questions do we have, if any, or reactions?
Wow, Guadalupe, that was amazing. Thank you so much. I already have so much self-reflection about how I felt about code switching and how I can advocate for it now. Yeah, you know, with the few minutes we have, I will release the survey to get your CEU at the end, but I'd love to spend some time opening it up for discussion. If anyone would like to provide their critical reflection or ask a question. Okay, so I see 2 hands. All right, Sarah.
Hi, good afternoon. I am in Ms. Cornejo's current CHW class. And I just like to say, like, without even knowing, at first I saw the topic today and I was like, code switching. What is that? You know, I'm new to the field, coming from the medical background. But yeah, it definitely resonated with me because I'm being more aware of, even when I'm not at work or I'm not in class, just in the community, like, hey, you know, let me not give somebody a bad look in the HEB line or something, because who knows, next week they might be my client or they may be needing a service, you know. And so just being more aware, like, of perspective of others, of myself, and especially with dress code as well. And I feel more confident, you know, now that I'm putting that more like a step forward, feeling more confident in my work. So I want to share that.
Sarah, thank you so much for sharing. Yes, it's you know, in terms of dress code, I said, you know, dress for the occasion. I'm sure you'll see me at HEB, but if I'm in myself, just being my, you know, being Guadalupe going to the HEB, you'll probably see me dressed differently. But yeah, I mean, dress code when navigating new places is something that I really put effort into because I don't want to be dismissed. I don't want to be feel ignored. And it is your presence and how people perceive you and how you sometimes will be treated. So I remember always getting after my dad because, you know, as he was getting old, like he was working outside and it was time to go to the doctor and he would just be like, and son así los señores. He will put like the oldest t-shirt he will find, right? And I'm like, Dad, you cannot dress like that. So I was just trying to tell him, you know, we're going to the doctor. People are gonna be giving us looks if you're, you know, if you're dressed that way. And we're Mexicans, we cannot afford to do that, you know. And but you know, those things that it's just with the experience and the knowledge and exposure that we gain awareness.
Thanks. I saw Dulce Maria's hand up before.
Oh yeah, but my camera is not working.
No worries.
I just want to comment that for my work, we have to use a t-shirt. And sometimes we go to businesses and they are like, no, I need to speak to your manager. Like we're not professionals or we're not, you know, I feel bad.
Yeah.
And I cannot change the dress code because that's my uniform.
Oh, well, I'm sorry that you encountered that because I know how that feels. That's why I rarely use t-shirts because I just don't look good in t-shirts. But but yes, I mean, I think you should really have a meeting with your team leader and say, you know, this is how I'm being perceived and this is how it's impacting me and my self-confidence and my presentation. So, you know, maybe adding a blazer or something that can add a little bit more style. When I was they did when I was working with the Lipstone Foundation, they gave us t-shirts and I remember that I added a little belt and like people were commenting like I was being fashionista as I was wearing a t-shirt and a skirt. But again, those little things that can add to your personality and add a little bit of confidence to your attire so that you can regain that self-confidence.
This is Carla.
Thank you.
There's something sometimes, you know, with my teams, you know, they needed to wear t-shirts in the environment they were and what they were doing. But they always had a badge. And the badge always alerted people to this is a, you know, a specific type of specialist. She is our member advocate. She is so if even, you know, talking to the company about, can you get us a badge that's professional, that shows us, you know, that shows the people that we're with that we are professionals and we are working for a specific organization. And I think that might help. Not worry.
Absolutely. I completely agree with that. Yes, you know, And I feel for the small nonprofit organizations that they may not invest in that, but that is very important. And as well as your CHW badge that you get from the state. So I
Right.
remember, when during the pandemic for almost 2 years, the state stopped sending those IDs, and those are like the gate openers for many people that will have to go and do home visits at the hospitals. But you work for a small organization, right? And so how will you establish credibility with clinicians when you just show up and show your blank organization name, right? But when you turn it around and just show the state of Texas, I'm credentialed by the state of Texas, people treat you differently. So yes, I would say, I always make the point also to carry my ID or my badge, because it does add, it does, people will question you less. I'm not saying they will completely remove the barriers, but it does help. Thank you for the comment.
Ability, right?
I love that. I'm now going to dress up t-shirts with blazers. I think I've seen that recently and I loved it. Maybe it was you, Guadalupe, last week when we saw each other. So I'm gonna, I saw that Janie had her hand raised. So Janie, I'm gonna let you speak. For anyone who doesn't have an eye on the chat box, I did put the link in for the CEU. So before you leave, just make sure you complete that if you want to CEU for today. We may go a couple minutes over, but I think that's fine if you have time to stick around. But if you need to head off for a 1 p.m. meeting, then thank you. And I will say, just remember, if you're doing this during your working hours, thank your team or your supervisor for supporting your on-the-job professional development. Not everyone is able to get off during hours, and that's something that as a group we also want to support. So even though it seems obvious to support your training, just tell someone thank you for them allowing you this hour to be with us today. But yeah, let's continue for for a few more minutes. Janie.
Thank you. You're good. Dr. Ms. Cornejo, thank you so much. Code switching. I had no idea that term even existed. As CHWs, we are always changing our role as we go depending on the day or the task at hand. So we're always changing our approach depending where we're going, whether we're going to a conference or training or with the community. We're always, I didn't realize that there was a term for it. So thank you so much for this presentation. It was an eye opener for me. And yes, I do dress up my t-shirts with a blazer now. I learned that through a colleague of mine that kept on insisting that I needed to dress up my t-shirt. And I've been doing that for about 2 years now. So dress code is important, but I think also we have to be very mindful as to where we're going. Sometimes being too dressed up may intimidate some of our community members. So as a CHW, I have to remember that. So be mindful of where we're going, what location we're going to be at, and our population, because it's very important not to intimidate them either. So yeah, so thank you so much. I learned a lot today.
Thank you so much for the comment. Yes, it helps. Appreciate it.
Thanks. Melissa, I see your hand raised.
Hey, thank you. Thanks for bringing attention to the topic. So you at the onset, you had said that it's not really an academic subject. I wanted to see if you've looked into or have also discussed code switching in terms of tone policing and respectability politics. A lot of times, if we are working in advocacy, it's something that comes up. There are some academic papers on it, but not as addressed or presented as like, this is exactly what it is, but more in how it relates to policing of certain communities, how we are treated in certain areas as someone from the border, and now I'm teaching at universities. I talk about how I talk to my friends and my family back home and how I have to present in front of my class, but also giving that space to other first-gen students or other communities that I go into of you know, letting them know that there's no like respectability politics there. There's no judgment on any situations. So I just wanted to know if you've discussed those or if you've had that come up in discussions as well. Thank you so much.
Thank you so much for the question. No, I haven't really done. I'm talking about this topic because Cheyenne asked me to. So I haven't really done research on that, but I totally understand and I feel it, right, as I cross the border uh, from Mexico to the U.S. I mean, you see it, you feel it, you feel how the law enforcement looks at you. I always compare it to how I felt crossing the border to how Palestinians may feel crossing the border to Israel. Then I had the opportunity to actually cross the border of Palestinian and Israel, and I'm like, yes, I confirm, it feels the same way. As a brown person, as a primarily speaking or only Spanish speaking person, this is how it feels. You are mistreated. You are spoken differently. You are more, you know, they want to know more about you. The policing, yes, everything to what you said, but I have not explored in that area. But I agree. I think in my classroom I talk about embracing who we are, learning about other cultures, and not just on the book, but actually making the effort to go and learn about who they are in the places where they are, right? And then to be proud of who we are. For me, I think one of the classes that helped me gain confidence was a UTSA, and I took a Latino, I forgot the name of the class, but I think many of you know Dr. Negrete. And without knowing her, she changed my life because I went through high school. I repeated high school when I came to Mexico, from Mexico, because we didn't know any better. We had no connection. So I repeated high school all over again. I didn't speak, I spoke just the basics, but I didn't really have conversations for the first 4 years of my life here in the US because I was so afraid of making mistakes, people making fun of you, treating you differently, and then high school is tough. So it wasn't until I took that class that helped me to regain pride on who I am, where I come from, and that's how I kind of started building up my self-esteem and my self-worth. But aside from, and then the advocacy area, my God, that's a total different area in terms of policy and what we as CHWs can actually bring to the table, because we are the ones that can see on the ground how certain policies are impacting people on a day-to-day basis.
Thank you so much.
Thanks. I think there's so many ways you can take this conversation, and when talking about code switching, there's respect for others, respect for yourself, building your own self-esteem, tipping the scales of power and prejudice, and that's why I love the topic of code switching. So Guadalupe, thanks for presenting on this. Now we need to get your this state certified for a DSHS and do it again. I see that Eugene put something in the chat box. I'm assuming it's a book, People of the Dawn, the First Medicine Men and Women. So Eugene, thanks for that. We're officially 5 minutes over, but Julia, I see that you came off video, so I just want to see, do you have a comment or a question?
Yes, I do.
Yeah.
Hi, Ms. Cornejo. I just wanted to thank you, because we didn't even realize we were doing that in class, and but I think it's very necessary, because as we look at the different conversations and stuff in our classrooms, and we reveal that even as written work, we need to be able to clarify what it is we're trying to say. And sometimes, it gets frustrating when others don't really, you don't really understand the conversation. So I thank you that you clarified that for us.
Thank you so much for the comment, Julia. Yes. Yes, and then reading communication is another monster. Like for me, it's like as English as a second language. Like I struggle. I spend quite some time sending emails out when I want to sound professional and correct. So it's an effort. Uh, on that regard, make use of technology to check for spelling and grammar, or even to find out different ways to say what you want to say, but not using words that you will not necessarily use, but still sound professional. Like I spend a lot of time doing that.
Yeah. All right. Well, thank you all for joining. I'll send a recap after this, and just remember to grab the link in the chat box to request your CEU. And then we'll come back in January. January is gonna be interesting. It's either gonna be January or February, but we're actually gonna have someone come on and how to provide tips, not legal advice, on doing your taxes if you receive a stipend for your CHW work. Yeah, it'll be a little bit different one, but I think, just the way that the community health workforce is employed, not everyone is a W-2 employee. And so maybe doing taxes are a little bit more challenging. If you're receiving stipends from different organizations. So yeah, please come back. I'll send out a registration link when we have that all set up, and everyone have a warm and safe holiday, and healthy holiday, I hope.
Yes. Thanks, Shay, for putting this together and for your leadership. Appreciate it.
Yeah.
And thanks everyone for your time, for joining us.
Awesome. Bye, everyone.